Okay, so what is an imaging portfolio? There's really nothing fancy or complicated about this, but it may be a concept that you do not consider initially until you receive complaints. Basically, an imaging portfolio is a file of significant images that are saved for subsequent review. It should provide a brief overview of each case. Many of you may already be familiar with this concept if you have been using a CAD system, as both Dynacad and CADstream systems allow you to create a file of saved images. You can even utilize the option of automatically creating this file if you wish. We have found this can limit flexibility in individually tailoring each case, and we have chosen to create our files manually. Why is this important? As if there's not already enough to deal with in breast MRI. Well, it is important because once you complete a breast MRI exam, you will have created 1,000 to 2,000 images, which will either be saved on a CD or archived in your PACS system. Once you have reviewed the case on your CAD system, you may never think twice about how it is archived. That is, at least until you have a reason to go back and review a case, or even more importantly, when a referring or outside physician tries to review the case and finds themselves faced with trying to view all 1,000 to 2,000 images, usually on an office PC. They will pop in the CD, generally accustomed to viewing 2 views of a chest X-ray, or possibly 50 or 60 CT or MRI images. Popping in a CD from a breast MRI will generally be overwhelming, not only by virtue of the number of images, but also as most referring physicians will have no idea how to approach viewing all of these images. As a result, they will no longer look at your MRI images and hence decrease the value of your exam in helping them plan surgical procedures or have an overview of the extent of the disease. This in turn will decrease the end result or benefit of your study. If you work closely with your physicians, they will tell you very quickly about this problem. If, however, you are just establishing relationships, you may not realize this difficulty until well into your program. It is for this reason that we feel it is important to develop a method for creating an imaging portfolio early on in your program. So what are some tips for developing this file of significant images? First, you need to sit down and, utilizing your approach to image interpretation, develop an organized filming sequence for significant images. Bear in mind that this sequence should be agreed upon by all radiologists involved in interpreting breast MRI. You don't want to have a different viewing format presented to the referring physicians depending on which radiologist performs the interpretation. We feel that it is important that with every breast MRI, the order of images presented is identical so that it becomes very easy and routine for your referring physicians to become quickly oriented and quickly review the case. This should be something that is created for every patient, not just the ones with pathology. Create it for your normal cases. Make it just part of your routine interpretation. Once you have created this file, however, make sure you consider 2 additional issues. First, evaluate how the significant file will be managed within your PACS system if you are utilizing PACS. After creating portfolios, it was several weeks before we realized that the saved file of significant images was placed at the very end of all of the images within the PACS file. Subsequently, when our referring physicians opened a case in their office, they would have to advance through all images to get to the significant file. This often took time that they did not have. We found that there was a way to place our portfolio of significant images as a priority at the beginning of all the series. Secondly, if you are creating or burning a CD to send with the patient, possibly for outside review or a second opinion, consider what images should be saved on that CD. We would initially burn a CD including all images from the acquisition. We again found out subsequently that individuals reviewing our cases from outside institutions found it very difficult to wade through the large number of images, particularly when they were not familiar with our format. We have subsequently begun burning CDs only with our significant image file, as we feel it gives an overview of the case as well as shows all the significant findings. We place a standardized note within the CD file stating that the CD is provided only with significant images. If all images are felt necessary, these can be provided as requested, and so far no one's made this request. Here's an example of our standardized imaging portfolio. In keeping with our approach to image interpretation, we first save the 1-minute subtraction MIP image. We will then usually save the image with color parametric mapping overlay. We subsequently save an orthogonal MIP of the 1-minute subtraction to provide orientation as to the precise location of any abnormality. When utilizing our parallel imaging techniques with fat-saturated dynamic acquisitions, we will then film the 1-minute fat-saturated thin MIPs, always proceeding from superior to inferior in an axial parallel acquisition, or from medial to lateral, beginning at the internal mammary arteries with a sagittal acquisition. In the case of a negative or normal MRI, this completes the portfolio. If, however, there is pathology, we will then go back and begin filming individual slices which evaluate the pathology. In general, we always provide images from the dynamic acquisition showing the raw data, the subtracted data, and subsequently the raw data with color parametric mapping applied. We then include the enhancement kinetic curves. When applicable, we will also film additional images, such as serial images of the STIR acquisition in cases of extensive cystic changes of the breast, or when there are other findings on the unenhanced sequences that are of benefit to the case. Once you put all of the work into providing a high-quality exam and a high-quality interpretation, you want to be able to relay that information to referring physicians so they can get the maximal benefit from it. In order to accomplish this, we feel that it is critical that you develop a standardized method of presenting your images to your referring docs, and that you do it with every patient. They will quickly become accustomed to a format where they can easily and in a very short period of time review each case. They will then see time and time again the benefit that you are able to provide them and their patients with this phenomenal imaging technique.